Hi, my name's Claire and I'm a registered nurse and a patient care advisor here at Medbelle. My team and I are here to support you through every step of your journey, and we've made this short video to make sure you're fully informed about your upcoming treatment. Cosmetic surgery can be a significant, life-changing event, so not only do we help you find a fully qualified and experienced surgeon, but we also think it's important for you to understand exactly what's involved. The information we provide in this video is generalised to all our patients. Because of this, it's important to recognise that your surgeon is the best person to give individual advice about surgical techniques, post-operative care and the risk of complications. Nonetheless, having a good understanding of your surgery means that during your consultation, you and your surgeon can focus on talking about what really matters to you. So, let's get started. The medical term used for a breast uplift is Mastopexy. The aim of this procedure is to lift and reshape the breast to give them a firmer, younger-looking appearance. Our surgeons achieve this effect by firstly making incisions in the breast, then lifting them and stitching them into their new position. Any excess skin is then removed and the nipples may be relocated to be more aligned with the new heightened position of your breasts. In some cases, the surgeon may also feel it's necessary to reshape or reduce the size of the areola during the uplift, so as to achieve the best possible overall aesthetic for your breasts. During your consultation, your surgeon will discuss the specifics of the procedure and what will work best for you and for your body. It's important to be aware that cosmetic surgery is individual to each patient, meaning that what you need may differ from what another patient needs. The procedure itself generally lasts between 1.5 to 3 hours, depending on the degree of lift required. There are typically 3 places in which the incisions can be made: circumareolar, vertical and inverted T. A circumareolar incision, also called a donut incision, is a single incision that's made around the full circumference of the areola. This incision is typically used if there is mild drooping of the breasts and only a small amount of excess tissue needs removing. This technique can be effective in helping to reduce the size of the areola and can also be used alongside a breast augmentation, where the breast uplift is also required. A vertical incision, also called the Lollipop incision, involves making one incision around the full circumference of the areola, plus a second incision that runs down from the bottom border of the areola to the crease of the breast. Now, this incision is typically used if there's only a moderate amount of drooping of the breasts. It is a commonly used technique, but it's not particularly effective for larger breasts. And finally, the inverted T incision, also known as the anchor incision, requires 3 incisions. The first 2 incisions are the same as those used in the Lollipop technique, and the final incision runs horizontally along the breast crease where the underwire of your bra would be. This technique is often used for breasts with a larger amount of drooping that need a greater amount of excess skin to be removed. It is important, however, to bear in mind that this procedure may not work for very large breasts, and in this case your surgeon may recommend that a breast reduction is better for you. As mentioned previously, some patients having a breast augmentation may also require a lift. For this, the peri-areolar incision, also called the crescent incision, can be used and involves the surgeon making a small half-semicircle incision around the top of the areola to lift the breast by just a fractional amount. The method your surgeon chooses will be individual to you and will depend on your breast size, the shape, the areola size and position, the degree of breast sagging and the quality and quantity of your skin. As breast surgery requires incisions to be made, minimal scarring is unavoidable. In most cases, however, the scars are relatively mild and they become thin and barely visible over time. Although, unfortunately, scars are unavoidable, there are many scar-reducing techniques that can be found in the post-operative guide that we'll send you prior to your surgery. It's also important to be aware that all breast uplift techniques are likely to affect breast sensation and breastfeeding to varying degrees. Your surgeon will be able to tell you exactly which surgical technique is best for you and how this will affect breast sensation and breastfeeding. How you prepare for your recovery depends on how physically demanding your daily life and work routines are. Your surgeon will advise you specifically about the timeframes for recovery and when you can restart your normal daily activities and exercise. But as an estimated generalised guide, we advise the following. If your job includes a lot of physical activity, for example, nursing, waitressing, caring for young children, you need to plan to take at least 2 weeks off. If you've got an office job or a job that doesn't require a huge amount of moving or lifting, we recommend taking at least a week off work. Afterwards, you do need to be sensible and listen to your body. If it's telling you to stay at home and rest, then stay at home and rest. If you've got young children, then you'll need to get your family to pitch in and help out. With regards to exercise, we recommend that in the first 6 weeks you don't exercise at all. In particular, you need to avoid strenuous activity and heavy lifting, but even basic aerobic activities can lead to an increase in swelling. After the 6 weeks have passed, you should be able to continue with all your normal sports and activities. There are a few other points you need to be aware of when preparing for recovery. Now, because anaesthetic substances stay in your system post-operatively, we recommend you don't drive for at least 5 days, up to 2 weeks after your surgery. And this is actually a safety precaution to ensure that all the anaesthetic and analgesic agents have worn off before you begin driving. The next point to consider is that you may not be able to shower or have a full bath in the first 24 hours, up to a few days after your surgery. And this is because it's important for you to keep your dressings and stitches as dry as possible before they're removed. If your surgeon has used liquid skin adhesive as part of the wound closure process, you may actually need to keep that area dry for up to 2 weeks. You'll also be required to wear a supportive bra day and night for up to 6 weeks after your treatment, and this helps to reduce the swelling and to promote really good wound healing. After you've gone through your initial recovery phase, your body should have healed enough for you to see the full, permanent results about 6 to 12 months after your surgery. Now, as this video and the brochures offer generalised advice given to all our patients, we do highly emphasise that you need to follow the post-operative care and advice that your surgeon recommends, as this is specific to you and to your recovery. It is important to acknowledge that although your selected treatment is an elective surgery, there are, as with any surgery, risks and complications to be aware of. The complications that can occur during the surgical procedure include excessive bleeding, blood clot formation, and an adverse reaction to the general anaesthetic. There are complications that can occur after the surgery, which you also need to be aware of. Now, infections would be quite problematic and have to be taken seriously if they occur. If you are affected, it would become apparent over the first 2 to 3 weeks after your surgery. A mild infection, such as a wound infection, settles down with antibiotics. And of course, the package price you pay for your breast uplift will cover the cost of dealing with any infection. Internal bleeding is another potential complication. This usually occurs immediately after the operation, but very occasionally it can happen up to 2 weeks later. If there is bleeding present, your breast would become swollen and tight, and you'd need to return to the operating room for further surgery. You are likely to spend an extra night in hospital, and you might feel a little bit more bruised than expected, but everything should settle down over time, and it's unlikely to affect your final results. After surgery, it can be quite common to experience a little bit of alteration in your breast or nipple sensation. This usually presents with either an increased or decreased level of sensitivity around the scar and the nipples. In very rare cases, the surgery can result in a complete loss of nipple sensation, but choosing a highly skilled surgeon will reduce the risk of complications occurring. In most cases, however, numbness and oversensitivity are temporary and they gradually settle down over time. It is sensible for you to be aware that there's always a risk you're not satisfied with the aesthetic result of your surgery. You could be unhappy with the size, the shape or the symmetry of your breasts, and it is for this reason we advise our patients to choose the surgeon really carefully. Make sure that he or she fully understands your expectations. It's really important to be candid with your surgeon about the results that you want. And we try our best to help this by ensuring that your surgeon is a highly experienced BAPS or BAPRAS member. Your surgeon will be able to discuss the risk of developing all these complications with you in much greater detail during your consultation. Although uncommon, some women have difficulty breastfeeding after a mastopexy. On average, there's roughly a 90% chance that you'll still be able to breastfeed on the assumption you were actually able to breastfeed before having surgery. Because the surgical incisions are made around the nipple, there's a risk that the nerves and milk ducts in your breast can become damaged. In most cases, if damage occurs, it will result in your breast producing a reduced amount of milk. In some cases, the breast can stop producing milk altogether, but as I said, this is quite uncommon. If you are worried about producing a reduced amount of milk during a feed, you can actually increase your milk supply by using a breast pump after each feed and gently massaging your breasts. These techniques help to increase your milk supply. And it's really important to notify your surgeon if you are planning to breastfeed after surgery, so they can give you the right advice regarding this. When you go for your breast uplift consultation, be prepared to discuss the following: why you want a breast uplift, along with your expectations and the desired outcome, your medical conditions, allergies and any previous medical treatments, any family history of breast cancer and the results of any mammograms or biopsies that you've had, and finally your current medications, vitamins, herbal supplements, alcohol, tobacco and drug use. In order to make sure that you're well prepared for surgery, our partner surgeons would like to promote the following advice. Smoking, alcohol, a high BMI and any form of drug use, whether medicinal or recreational, can actually increase your risk of developing complications during and after surgery. In order to reduce the risk, our surgeons strongly advise our patients to stop smoking completely and using all nicotine products at least 6 weeks before your treatment. Smoking in particular is discouraged as it actually increases the risk of infection and it delays the healing process. It is worth also noting that several homeopathic medications available over the counter and taken for general well-being can actually negatively affect the outcome of cosmetic surgery. Such medications include, but are not limited to, those containing ginger, garlic, cod liver oil, St. John's wort, aspirin and several preparations of multivitamins. We therefore advise you that all homeopathic medication is stopped 2 weeks before cosmetic surgery to reduce the risk of post-operative bleeding, excessive bruising and hematoma. After your surgeon has covered your medical history, general health status and medications, they will then examine and measure your breasts, including detailed measurements of the size, the shape, the skin quality and the placement of the nipples and areolas. They'll take photographs, discuss your options and recommend a course of treatment. And finally, they'll discuss any likely outcomes of the breast lift surgery and any risks or potential complications. Your consultation time is your opportunity to be as honest and candid as possible with your surgeon about what you want to achieve. It may also be helpful to ask your surgeon what you can do to help to achieve the best results from surgery. So now, on to what happens next. Essentially, your patient care advisor here at Medbelle will be your main point of contact throughout the whole process. We'll schedule a call with you for shortly after your consultation. This is to discuss how your consultation went and to start planning your treatment journey for you. You'll also receive an email from us that details the specifics of what that journey entails. And we will, of course, regularly check in with you during the recovery process, ensuring that you feel fully supported the entire time. If you've got any questions regarding any of the information we've provided, please don't hesitate to give us a call and we'll answer them for you. Thank you for listening to this Medbelle pre-consultation video. We wish you all the best of luck with your consultation and we can't wait to find out how it went.